And put us back on our little card here for the recording.
Okay, should we give it just a couple more minutes?
So Marcia, I have an update for you after the meeting if you.
Okay, it's 1:02 your time. Are we ready to go?
Yes.
Okay. Good afternoon. It is Wednesday, August 18th, 2021 at 1:02 p.m. This is the meeting for the Pershing County Board of Health. All items on this agenda are approximate. Consideration of items may require more or less time than is scheduled. Items assigned, times will be discussed prior to their assigned times. Items on the agenda may be taken out of order. The public body may combine two or more agenda items for consideration. The public body may remove an item from the agenda or delay discussion at any time. All righty, we're going to go to item number 1, calling this meeting to order. And need to have a motion to approve minutes from the prior meeting.
I'll make that motion.
Is there a second? Okay, thank you. All right, item agenda number 2, public input, public comments and discussion. No action may be taken on a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action will be taken. Public commentary will generally be limited to 3 minutes per person. Any public input?
Yes, Dr. Mendez, this is Marcia.
Hey,
So
Marcia.
So for the drive-through flu shot for the seasonal flu, for
Yeah.
September 30th from 3 to 7, drive-through at the Lovelock Community Center, like always. Okay, we need to push this. I know there's a lot of people that are under the impression we don't have the flu anymore because we didn't have any flu last year. I've heard it all. But we've got some of the flyers here and we need help, of course.
Okay.
From the community. And we also need to get people going because we all know that last year we were doing the right thing. We weren't breathing on each other. We weren't touching each other. That's why we didn't have very many flus and that type of thing. So if we can get that word out around.
Okay, we will.
Marcia, what time did you say that was again? This is Cindy.
So it is September 30th at the Community Event Center from 3 p.m. to 7 p.m.
Okay, thank you.
Great. Any other public comment? Nope. Okay. Let's be moving on to item number 3, COVID-19 status update in Pershing County. I'm going to have Tyson, our deputy health officer, give us some information since he's been taking the helm since I'm out of town.
Okay, and first, can you hear me?
Yes.
Yes.
Okay, perfect. So right now we stand in our county with 988 positive tests total. For our community, we are at 224, which is included in that total number. To be aware of where we're at right now, in this month alone, in just the month of August, we've had 14 positive cases. 10 of them have been in the last 6 days.
How many, Tyson?
Let's see, we're at 14 total in this month.
And Tyson, are many of
And
those
then
are the
10 of those 14 were in the last 6 days. We've had 4 hospitalizations and at least a couple needing to go to the ER for a bit and then sent home, and 1 transferred out to a larger hospital.
Have very many of them been coming from the prison or are they in the community?
In the community
That's
so far.
Have you been able,
All of these
Tyson?
in this month is the community.
Tyson, have you been able to
Yes.
track, have you been able to track why it increased? Like, did they go to Night in the Country, for instance, or was there one person or that spread it or anything like that?
So far, it's been at least through 3 different main groups that I can think of. Mostly just no masks, staying close together. Some that have been positive still have had the vaccine and ended up with symptoms regardless of having that vaccine. So they were mild cases for the most part, or at least would have been, given their risk factors, should have been very serious. But thank goodness they had that vaccine, because that's the only thing I can think of for some of these patients.
Okay, thank you.
Yeah.
Yeah, so this Delta variant is known to be extremely infectious, 50% more so than the most recent other variant. That's what these viruses do. They get smarter, stronger, faster. One person infected can infect up to 15 at this point, other people. It's that contagious. It is, once you have one in the community, you can pretty much guarantee it's going to exponentially increase, which is what we have seen since our first one at the end of July. We stopped, as of yesterday, sending out state lab variant tests because it's just going to overwhelm everybody since the numbers are up so high everywhere. 99% of cases that are ongoing have been typed as the Delta variant. What is kind of alarming to what we have seen in our community, we had 3 COVID pneumonias in our hospital in 18 hours. That was just the other day. And some of these folks went from feeling well to short of breath and hypoxic within 2 hours. So this is very, very quick and can turn on a dime. So people just need to try to please get back to masks. I know it's a bummer. Hoped we'd never get here, but we just haven't been able to get the vaccination rate up to where it's going to make that much of a difference. We do have the Regeneron monoclonal antibody treatment for people who are sick or infected in an outpatient setting. That is what it's recommended for. That antibody helps your body fight the virus and helps you recover quicker. The earlier you get it after diagnosis, the better off you're going to be. It's given day 1 to 10 after diagnosis. You can't get it after day 10. And we have seen this anecdotally in our facility that if you wait, it can still help, but it doesn't help you as much as if you get it early. And that's what's been going on, around the country, around the world. So it's an excellent tool we have. It's not limitless. We have a fair number of doses right now. Our pharmacist says it's still readily available, but the use of this across the country has gone up 1,200% in the last 2 weeks. And they're starting clinics again, outpatient clinics set up just for this infusion or injection. We have limited staff, so that continues to always be our issue. We'd like to provide that if we can, if needed, but the most efficacious way to prevent this and to prevent serious illness and death is to get vaccinated. We may be behind the ball again on that, but please encourage people to get vaccinated. Let's see, what else? Tyson, did you have anything else you wanted to comment on?
Nothing else to add, no. Nope.
Okay. I'll just mention this as far as vaccines. We're back on the COVID roller coaster right now with things changing every day. Vaccines are becoming required in lots of places. That's going to continue to change over time. CMS just is probably in the next few days, per the most recent email and CNN research I just did, is CMS is probably going to require nursing homes to vaccinate their staff in order to continue to receive funding. Many hospitals and other businesses around the country are already mandating the vaccine. It should have full FDA approval probably before the end of this month, which may or may not make things move faster towards mandates. I know there's still a lot of hesitancy. There's still a lot of fear. Please just encourage anybody, if they have questions, ask people who know, try to, avoid disinformation. It's very safe. There was a meeting for the Nevada Vaccine Equity collaboration at 11 today. They're coming up with a lot more signage and other information that may be helpful. for everybody. Dr. Pasternak, who is in charge of the vaccine in the state, has mandated it, the vaccine for all his employees, which I think is a great, bold move. Third doses for immunocompromised folks has already been authorized and is being moved forward. So in the meeting today, they made a very good distinction about that between the third dose for people who are immunocompromised, meaning that the 2 doses is probably not adequate for their immune system, so they need a third dose, versus booster doses for those of us who were vaccinated early. And we have seen immunity wane after about 8 months of initial vaccination, which for some of us, we have already approached because we were among the first to vaccinate in the long-term care population providers. So we'll have more coming on that soon. So I think that's it for me. Does anybody have any questions about what we've talked about so far?
So, Doctor, this is Marcia. I just kind of wanted to input with what you have already done. So the state of Nevada began mandatory testing weekly for those that are not vaccinated for all state employees. So this started Tuesday because they didn't have the ducks in a row on Monday. So what I have seen in Winnemucca is it's having the opposite effect. It's forcing people to put their boots in the ground, and people are not going to tell me what to do. So instead of, people saying, okay, I'll just go ahead and get vaccinated, like, no, they're not going to tell me what to do, type thing. So, sites here in Lovelock, there is no sites in Winnemucca. They have to all be virtual in Winnemucca. I talked to one state office yesterday. Absolutely no one in the office is vaccinated, and absolutely no one will be tested for their choice. They said they'll just wait until termination persists. So I don't know what's going to go on with that. That's just out there, so everyone knows. I think we may end up with the same type of thing if they pursue that with long-term care. We're already so short-staffed with our long-term care and our senior centers and everything. I hate, we need to get vaccinated, yes, but I hate for something to lose and cause the loss of employees also, because, and the problem is now they can go anywhere and get a job. Type thing. The other thing on a completely different note is, so on some of these meetings that I've been on the third dose. So the third dose has a very strict who is going to get it at this time. It's not for those that are diabetic or for those that are over 65. They have to be severely immunocompromised, on high dose steroids, have an organ transplant, HIV infection, on cancer treatment. Those type of things are the things that we're seeing for the third dose right now. As of September, they're looking at starting the third dose booster or third dose 8 months after your last vaccine. They just kind of threw this out there, and so at this time, I don't know, we'll have to check with the community whether we think we need to do pods again or not for this third dose, or if that's something that the clinic and us can handle on our own. How many people will go for those third doses and that type of thing. We're still giving a lot of first and second doses. We have given quite a few to the kids, the 12 and above of the Pfizer.
Hey.
We gave of first dose Moderna. So, you know, and we don't want to push our first and second dose people out for the third dose people.
Absolutely not. You're right.
And
Mhm.
that's one of the reasons that we are not one of the testing sites also, is that I'm only here one day a week. I didn't want to give up my day of seeing patients here just for testing.
Yeah. Yeah, so Marcia, on that note, what's our stock? What's the supply of vaccine available, or is it still abundantly available?
It is, well, the J&J is not. So actually, we only have 15 doses of J&J.
Okay,
Going on with that. But Moderna, we have 70 in the office, and I just ordered another 114 or 140, which we should get next week. Pfizer, I have 175 in Winnemucca because they have the cold storage at the hospital that they're keeping it for me. And I just ordered another 450 doses. So I just bring that as our schedule needed. And
wonderful.
Christina was giving it for the hospital and for the clinic, so I don't know who's doing that now, but we have those doses if anyone needs it. I can always bring it.
Okay, so Taylor,
Sorry,
but what?
Taylor Boone is doing the order, should order for the hospital now, the clinic.
Yes.
Right.
Mhm. Okay, so, that's, yeah, here we go again with the rapidly changing information. One other provider on the vaccine equity call today mentioned the fact that primary care providers can assess their patients on a case-by-case basis, because not just people with the very narrow criteria they're kind of citing right now are going to be the ones who need it. Someone who's had COVID twice and was vaccinated with 2 doses, like that person is gonna, benefit from a third dose clearly. So there's gonna be a little bit more discussion about that, but I don't know if people are going to need a note from their doctor to get a third dose or what the whole deal is. But as things emerge, I'll try to keep people updated on what I'm hearing about that.
And I think we only have 10 that they just open up the third doses anyway.
Wait, what?
I think we're only on like a 2-week window of when they're gonna open up for the third dose for anyone who's been dosed for 8 months. or greater.
Right. The booster versus the third dose for immunocompromised, right? Yeah, it's coming right around the corner.
Yeah, and they can do a test also. So if someone comes in my office and says, I have HIV or I'm on cancer treatments, I have no right to dive into their personal information. I have to take them at their word.
Exactly. Mhm. Okay. Great. Let's see what else here. Okay, so I think we will move on as far as on the agenda number 4, Pershing County's recovery plan. So our recovery plan, we're still, on our own as a county. We're no longer under the state's direct rule. COVID mitigation, obviously we need to reassess because our numbers are going nuts again. Local mask mandate, we just received notification that we've had 2 weeks in a row of increased rates of infection. And that again is going to lag behind when we actually start seeing things. So, but as of this Friday, the 20th, the masks were on the high risk list. And we will need to try to encourage, although I can't enforce it necessarily, we need to go back to everyone wears a mask, try to social distance, wash your hands, that kind of stuff. Um, and that's pretty much almost all counties in Nevada right now. And I don't see that going down for a little while yet. So people need to just get comfortable with the mask idea again and try to, stop the spread of this thing. It's scary again. Carol, did you want to talk about that in any way?
Well, I just have a question. Someone asked me, we got that that information from the governor's office, and yet when they go to the state site to look up the reporting, it doesn't show those numbers. So why is there the discrepancy?
What do you mean, the dashboard?
Yes, I think it's the dashboard they're looking at.
So again, there's a lag between when information goes from one person to the next person to the updated stats and that kind of thing. This is a rate of change, not just a number. It's the amount of positive cases versus the amount of total tested. And I don't have all of that number because people are tested in other places besides our location. But based on what I'm seeing, we should have been masked last week. It's
Okay.
the cat's out of the bag right now. And that's why I say, lag of getting things seen and then disseminated, and then the bureaucracy of somebody saying you have to do it versus the common sense of we see the cases going crazy, we should mask. Mask, vaccinate, my mantra. Yeah, so I don't have an answer for them about that other than, I'll double check the numbers, but we update them as soon as we get more numbers. Tyson's been doing that this week. And, I'll have to see if the state has another place to look at that, but data and stats are very confusing for people who are in this business, let alone for people who are not in this business. And our public health partners are very on top of this. And when they say that that's where we are, then that's where we are.
So as far as the mask, where it's still up to each individual person and what they're comfortable with?
No, everyone needs to wear a mask. Put a mask
Okay.
on
So,
everybody, unless
so-
you're in your, if you're out around other people you don't live with, if you're in groups or if you're indoors anywhere, please wear a mask. That's the only way we're going to stop the spread. People are asymptomatic and can spread this disease. You can have it and not know it. You can have a mild, what you think is a sinus infection, which is what I'm hearing from all of these people who have tested positive recently. I thought I just had a sinus infection. Any sign of cold, flu, anything like that, allergies, this can be COVID. We have to be careful. Please, please, please put your mask.
On Friday, the 20th, the mask mandate goes into effect.
Yes. Yes, it's the mandate is in effect, whether or not I can't make someone put a mask on. I have been informing everybody in my clinic when I was here last week to put your masks back on, because we know it's already here in a big way in our little county. And when we have to start transferring patients out of our hospital and they're deferring an admit because they're full, which they've done twice in the last 10 days, because the hospitals in Reno and Sparks are already filling up again. That to me is we are behind the ball. We're behind the curve. We need to remask. From a mandate, it's Friday. From the state and our numbers and what we're supposed to follow, mask mandates back in effect in our counties. But from a health perspective and for what we're seeing, if you're out in a store, vaccinated or not, please put your mask on.
So then for our county offices, for instance, we should put the signs back up saying that masks are required.
Yes, please. I mean, you can wait until Friday when it's technically required, but I would strongly encourage everybody start now. If you're not at home,
send people out like they did before, and all. That's always that possibility too.
Mhm.
You know, I don't know if that happened here in Pershing County, but I know on people. They
Say
sent
that
people
again?
find businesses and went to all the county offices and everything, and if the sign wasn't up, if the mask weren't on,
Mhm.
Yeah. Yeah, I mean, people know, we know are resistant to masks, many of them. So I don't know. I think you want to protect your employees. We don't want to get back to where we were before. So granted, if you're vaccinated, you're not likely to get seriously ill or die. I mean, the chances of that are very slim, which is why we have vaccines. But if you're positive, you still get to stay home for 10 days. You still have your employees out. You still, it affects everything. We're back where we were before. Even if you don't, get seriously ill or die, you can't work. You can't go out and do your normal stuff if you're infected. And we know that people who are vaccinated get infected. Just don't get really, really sick, hopefully.
So Dr.
So-
Daniel, how much of this stuff can one person take into their body without some kind of, something detrimental happening?
Wait, what?
for the vaccine, she's asking, how do we know how much is safe for the vaccine for the continued doses?
I mean, it's not even FDA approved.
Yeah, well, it is FDA approved for emergency use. It's going to be fully FDA approved in 2 weeks or less. We don't, that's clearly, going to be a future study, which is the same as all vaccines. It's very interesting. And I don't want to perseverate too long, but if you look at the history of vaccines, this is exactly what happened with smallpox vaccines, with polio vaccines, with measles vaccines. You fly by the seat of your pants initially when you have a pandemic. You just don't know. You start with one vaccine, you get another vaccine, you get a booster if you need a booster. This is very, very common. So as time goes on, we will continue to sort out how much is effective. Most of the time, I mean, from all the vaccines we've had around forever, people have had extra boosters and nothing has been detrimental. You get a sore arm and you might feel crummy for a couple of days. There actually was an article today. Well, maybe I just read it about Regeneron today, but some people are going to need maybe more than 3 down the road. We don't know. Same as Regeneron, the monoclonal antibodies. They're recommending that in some people who are immunocompromised and are exposed, getting a lower dose of Regeneron every 4 weeks to keep them from getting seriously ill. So it's an ongoing, effort to sort out what's best. But so far from the million, I think they've had over 1 million people almost get a 3rd dose, and there have been no adverse effects.
And what about the testing for the antibodies? Whatever happened to that so that we know whether?
Yeah. Well, it's not necessarily recommended. That was brought up today too. I mean, you could test your antibodies, but the antibodies are just one way that your immune system, can fight this. The T cell immunity is a totally different thing. That's another part of your immune system. And just like with hepatitis B, you say, don't check your antibodies if you're 10 years out because it could be negative, but you could still be protected. So a lot of this stuff is still ongoing. A majority of the people that I've seen who've asked for their antibodies to be tested have all been negative. So does that mean you're not protected? Maybe not. We don't know. Certainly you could get them tested. It's going to cost you some money and it's going to take a week to get it back. I really have seen very, very few antibody positives. So it's a good question. Time will tell. Back on that road, time will tell. Okay, anything else on the recovery plan? No. Yes.
Dr. Bangler, this is Justin.
Hi.
I think it might be a good idea for either the board as a whole or from you or Tyson or from the commissioners that a
some information, some statement is drafted
Mhm.
for posting on the website, county social media feeds, or wherever we need, say, explaining some of this stuff. Just to try and help get that information out to the public more.
More just specifically about the masks and our numbers, or about vaccines, or about all of it?
Yeah, kind of like a current state of the county type thing, because we've been posting numbers regularly, but we haven't really had like almost like a press release in quite a while. So
Thank you.
it really is probably past time that we had some sort of statement made to the public.
You betcha.
Is
Yeah.
Yeah, absolutely.
So I can draft something and send it on to you guys, and you can say yay or nay, or if you want to add something. Does that sound good, Carol, Tyson, everybody?
Yeah, it sounds great, because we need to let everybody know that we're back in mask, required masks.
Mhm.
And if it comes to the health board and county, people will pay more attention.
Great.
I agree. Sounds good.
Mhm. Okay. All right, moving on to item number 5, update regarding schools. Do we have any school officials on this call? No? Bummer. Okay. So I did reach out a couple weeks ago to Russell Fecht about this. They have a policy in place for schools for COVID. They're currently, as of the last statement, which was July 24th that he sent me, that they're going to encourage face masks for unvaccinated over age 2. Now that our numbers have gone up, that's going to be a mandate. So the kids will be back in masks, and I will touch base with him again about that. We have recently had some kids test positive on screening for sports, and that is part of the group of the outbreak currently. So thankfully, we were able to catch an asymptomatic person and then trace back several cases associated with that. So we're going to recommend some more frequent testing of some of the kids based on that, and we'll see what they do. I don't know. I can't really mandate that, but I think it makes sense. So I'll just be in touch, or Tyson's going to be in touch with the coach, hopefully later today or tomorrow. And then I'll try to get in touch with the school nurse and see if they have a plan in place, and how many tests they have available that they can do for their athletes.
Now,
Mhm.
with in fully vaccinated, do they not need to test?
For
I didn't
fat,
know if that, for Pershing County. I know in
For-
Humboldt County, if they have been fully vaccinated 2 weeks after, their second dose of the Pfizer, then they don't have to, sports don't have to, they don't have to test weekly. And I did give Christina 2 boxes of tests last week, and so she was gonna get some more. And if not, we'll provide her with how much she needs some more. Whatever we need to do to keep going. with
okay.
that.
Yeah, that's some,
I have a
Mhm.
plan. He's not being tested because he's vaccinated.
Okay,
And this is Cindy. I can kind of add a little bit for what the schools are going to test with. They have not completed their CLIA yet, but they're working on it. So Christina is still an employee of the hospital. She's been working under our CLIA, locked in as a nurse here. But very soon they'll be using a test called Perkin-Elmer, and that is a send out. So instead, the state wants us to get away from the Binax. And that's what the schools are gonna go with, is the Perkin-Elmer.
Thanks
So
for
they-
that.
And that's a PCR.
Yeah, they say that the Delta variant has a low viral load, and so it's not being picked up on those Binax now that we have.
Right.
More adaptations. Mhm.
Problem is, then we're gonna get backlogged with the labs again like we did before. Right now, it's a 3-day wait if you send out a PCR, but we all remember the days last fall when it was a 10 to 14 day, you were recovered before you got your test results. And we're gonna
Yeah.
it's logging up all the state employees, logging up all the students from all the high schools with the sports plus the regular testing. Because a lot of hospitals, well, the surgeries that have PCR, a lot of the airlines and the travel are requiring PCRs. And I know that, you know, they use the National Guard when things got tight last fall, but all of those people have gone back to their regular jobs.
The Perkin-Elmer is gonna go to a specific lab in California. And apparently, as of today, the results are supposed to be back within 24 to 48 hours. However, I don't think the state understands that the rules don't really have overnight mail. That's not necessarily a thing out here. I mean, it could take 2 to 3 days. So I'm expecting that the results won't come back that quickly, but plus the state testing will be the Perkin-Elmer, as I understand it as well. With the rules, we'll have a telehealth MA that they will, the state staff will contact, I guess, via Zoom or something with this MA and then do their test, this Perkin-Elmer test.
Fascinating. All right. So more to come as we see that progress. Thanks, Cindy. Okay, so moving on to item number 6. Unofficial Burning Man, also known as a Renegade Burning Man, is unfortunately coming to the Black Rock Desert. It is, I'm not sure if any of you have heard about it, but it is a group of people who are going to do their own Burning Man without the Burning Man organization. They estimate, I don't know, I think the most recent number was 12 to 15 or maybe more thousand people coming out to the playa. There is no official Burning Man, folks. So there's no official infrastructure. There's no permits, no funding available. The Nevada State Public Health partners came together, met with BLM, met with some of the tribal folks, some of law enforcement, and the health officer or the emergency managers for Humboldt, Pershing, and Humboldt, Pershing, and Washoe counties, trying to coordinate some type of response to try to mitigate disasters that can happen out there. Most importantly, they're worried about black water, gray water, waste, water, hydration, medical, and then just general, safety. We know that there's a lot of different things that go on in regular Burning Man, although this is going to be a lot less people. It looks like from the website they post, there's going to be lots of similar stuff they've had out in the past. So I have not heard yet from them this week if they were able to secure funds from the Corona Relief funds to get some of the things they were hoping, which looks like they're trying to negotiate some EMS through Humboldt. with some 28 staff members and around the clock care, not on the playa, but close. Truckee Meadow Fire District is going to be set up in Gerlach with 3 rigs. They have some limited numbers. Pershing County, Humboldt County Sheriff have already been in communication. There was some discussion about calling in or trying to call up the National Guard. I don't know, I haven't heard back yet about whether or not that has been finalized. They're having another meeting this Friday to kind of update. The dates for this are August 23rd to September 7th. The Burning Man website has some information posted for folks who are looking to come. The BLM has some safety measures and some very strict guidelines regarding no burns except for campfires, no structures. They're trying to do some things, but there's a lot they're not going to be able to do other than just trying to monitor for serious things. So I don't know. It's going to be very interesting, and it's right around the corner. So I'll be talking with the medical staff at the hospital and the nursing and everything after I hear Friday what if they were able to secure any particular things, and probably from a hospital disaster response standpoint, we're going to have to kind of have our heads ready to go if there is a mass casualty event or something bad that happens out there. It's going to be a COVID super spreader probability. They're worried about some cholera at one of the ponds, heat injury, smoke from these horrible fires. There's lots of things. So anyways, Polly is our one of the nurses who's most familiar with it out there. She's aware, and we'll just chat more once I have more from this meeting on Friday as to what other resources are hoping to have out there. Any questions? Yeah.
Who has tried to pre-stage or pre-authorize the National Guard?
That was somebody from the state that was on one of these calls. I cannot remember who. There were so many people, I don't really know all of their names, but I thought Sergeant Carmichael mentioned that he thought it would be a good idea to at least get them aware. I don't know all the steps it takes to get somebody, to get things to happen, but things can go bad really quick out there. I don't know. Have you been in contact with any of them?
Not with the National Guard. I tried a few years ago, and it's very difficult.
Yeah.
So that's why I'm curious as to under what authority and who's trying to do that. We may have mentioned that they're an avenue, but I don't believe that anyone from my office should be trying to pre-stage it unless it's for strictly an emergency to see what kind of resources they have should we need them.
Right. Do you have the communication? Did anyone forward that to you? I'm not sure if you were included on that feed from who was it? Lisa Sherrick, administrator. Did you get that? No, doesn't. Why don't once I get things coordinated here, I'll give you that information and I'll reach out to them and see if they've heard anything yet. What is your thought on that?
What is my thought on the National Guard?
Yeah.
I believe they'd be a resource if we were running through a mass casualty incident or an emergency incident to see what they had. I was told, I believe 4 or 5 years ago, is their staffing is very limited and their availability to get out to there is a longer response time than what it would be for Washoe County or Humboldt County to send us resources. So.
Yeah. Okay. So, we'll see. And then I guess we're just going to have to roll with it with what we've got. If something bad happens, well, let's just pray nothing bad happens. Oh gosh.
With that being
All right.
said, Dr. that we're trying to protect our county and the
Mhm.
state government don't allow this. So how do we protect our people here without putting our people, such as our sheriff's department, police department, EMTs at risk? Okay, are they gonna be wearing masks? Are they going to be, they're going in and out of Lovelock or whatever? I mean, why is it that this is I think, one of the biggest problems that we the people are having is that, we're gonna follow the mandates, okay, like little sheep. And then these people will be out there and God only knows where they're coming from and bringing whatever they're bringing to our county. I mean, it's.
Yep. I know.
I don't care if they have water. I don't care if they have food. I don't care if they have shit. I really don't care. Because they should.
Is it, I was told that they can't stop it because it's on BLM ground, is that correct?
Well, it's public land, so the public has the right to be out there.
That's what I
And
was
it's
wondering.
not, yes,
Yeah,
so
like
public-
not stop it.
The BLM can issue a closure order if they wanted to do so, but it's gone through all the way to DC. And this is just one of those prime examples of how much political sway
Yeah,
that an event like Burning Man organization has.
Right.
Whether they're gonna do the festival or not, or whether or not they're officially going to back this event, there is a lot of political sway all the way up to DC
And no one
to
wants
keep
to
the
make
public
the
lands open and accessible to the public.
Are they going to burn them in?
No,
Nope, nobody
They-
said that.
no,
But
they
that-
have said that. They have said no burning except for campfires, no structures to be erected except for sun tents. It's on the BLM website, but who's going to enforce these things? That's my question.
Special restrictions for that. However, with the thousands and millions of laws that this country has, there is always somebody that will go against those laws. So
Sure.
for me to stand that somebody is not going to burn a man, I cannot say that. Would it be against the closure order for BLM to do that? Yes, they'd be in violation of that. What the penalty would be, I have no idea.
Well, how do you stop 20,000 people from
No.
saying that they want to do?
right, so
You
20,000
have to
people of
mitigate.
us would
The
stand
best we
up.
can do is mitigate the issues we run into at the time, just like we would at any other mass gathering.
Yeah. Are we having fun yet? Gosh.
No.
I think that some of the things that I think the county, and I know everybody is tired of the mask, I know everybody's tired of all this. But I think especially during Burning Man, we need to make the gas stations, the grocery stores, McDonald's, the places that these people will stop and come in. They need to know that, they need to make this gas mandate something. To try and stop.
Yeah, but for us, oh, here we go again, it's
Yeah,
that's
it's
the
just
same
gonna-
thing.
Yeah, it's just gonna, if it's gonna be a super spreader,
Yeah,
it's gonna start in these small communities where they stop and buy their supplies.
I can add that if this is like most Burning Man festivals, very, very little traffic will come through the Pershing County communities because there are so many other ways for them to get out there and get their supplies. There are very few people that actually come through Lovelock, Inley, and Grass Valley to purchase their supplies for that festival. So.
Yeah.
There may be some, but it would be no different than anybody else passing through the community. It won't be the mass influx, like it would if we were to have it in the center of town, like Frontier Days or something like that. We were actually hosting.
Yeah, so we will try again to just make sure that everybody is made aware of the mask mandate. I'll get that statement put out to you guys later today or tomorrow. Let's see. Okay, unofficial burn, renegade Burning Man. I'll start praying now. And I'll let you know, Sheriff Allen, if I hear anything regarding that. I'll send you that letter from Lisa as well. Okay, moving on to item number 7. which I really hoped would be the focus of this conversation today, but alas, it is not. So I wanted to talk about health and wellness tools. I'm going to make this brief because I know everybody wants to get on with their day. I am going to post something or send it on to Justin on the 95210 for health. It is something I use for my pediatric visits, but I think is good for everybody. And that is the model that is 9-5-2-1-0, which stands for 9 hours of sleep, 5 fruits and vegetables a day, 2 hours or less of screen time beyond work, 1 hour of exercise, and 0 or very little sweet drinks and snacks. So I really think that that's a good, easy way to think about living healthy from eating well and getting enough rest and exercise. The other model is the 6 dimensions of wellness. There's lots of different wellness models. This one is just 6. There's 7, 8, 9, I think, but these are dimensions where we can focus to try to keep ourselves in the best health in a wellness model, including occupational, physical, social, intellectual, spiritual, and emotional. So I will, instead of talking ad nauseum about these things, I will just have Justin post a couple of things that people can reference to try to stay well and healthy. I'm going to try to get Melissa Washaba, our psychiatric nurse practitioner, to also make a list of mental health resources available, because we're going back into the not so fun days of COVID, and we're all so done with it already, but we're getting back to where we were before and worse. So we do have some resources in the office, some things she got grants for, puzzles and other things that can help people kind of if they're inside, and the smoke from the fires isn't helping because we're all having to stay inside from that too. Arg. Anyways, I'll have those things sent on and ask Justin to post and talk to Melissa about getting us some other information and resources for mental health. And Nevada 211 is still available for resources for everybody. I just wanted to try to just make sure we all remember to try to stay well. There's lots of different ways to do that. And all of these dimensions mean different things to different people because we're all in different places in all of these aspects. So just try to take care of yourself. And that's it for that. So any questions?
I do have
Melissa.
Hi. Yeah, I do have a few resources I can post into the chat box if you guys want. I think one that I really wanted to highlight was the Nevada Resilience Project that was created for COVID. And it's open to any Nevada residents, where you can actually call and talk to somebody about, if you're struggling with anxiety or unemployment or increased stress or anxiety about health or anything else. They're really able to connect you to a person to talk to, and also to other resources. So I think it's a really good starting point for someone who doesn't usually have to deal with the mental health system, but is really struggling now or knows somebody who is. So I will
Love
send
it.
that website into the chat box here, so you guys will know what it is. And yeah, I think it's a great idea to create some kind of handout or flyer or list that we can share more publicly.
Wonderful. Thank you. Awesome. Oh, good. It's part of Nevada 211. Perfect. Great. Any questions, anybody? Nope. Okay. Moving on to number 8. Announcements, I think we've talked about everything. Future meeting dates. I think we need to have a meeting in a month again, unfortunately. Things are just moving and changing too fast again. So what works for you guys?
Wednesday is a really good day for me.
When,
Okay, which Wednesday? Middle of the month?
so the 15th?
How about the 22nd?
22nd?
22nd.
Sure.
Does that work for you guys on commissioners?
Sure.
On the 15th.
22nd September, 1 PM. Board of Health. Carol, would you be able to try to get that time set, or do I need to email Karen?
No, I'll do it for you right after the meeting.
Thank you so much. Okay, so if anybody has anything between now and then that comes up that's needing to be addressed, please let me know and we can chat in between. And if you want any agenda items added, let me know as well. All right, so move forward to number 9, public comment. Public comments and discussion. No action may be taken on a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action will be taken. Public commentary will be limited to 3 minutes per person. Any comments? No comments. Okay. Number 10, move to adjourn.
Thank you, Dr.
all. Thank you. You guys take care.
Okay, you too.
What do you think?